Once again, I am Dr. Uche Wisdom ESEGBUE, the Purpose Doctor. One more time, I want to get to you for a very important topic. Yes? Okay. But take note, I'm your most sought out keynote speaker on various issues on health, purposeful living, successful living, and so on. Your life coach and author, a corporate mentor and counselor. I'm also a publisher. I want to welcome you to Wisdom Class Seminars for your health, business, success, and leadership ventures. Every third Saturday of the month at 10 a.m., Wisdom Class is located at PPA Auditorium opposite Bogo Petrol Station in Abraka. Today, I'm looking at a very interesting topic. I simply call it toilet disease, but I'm delving into an issue that need to be understood. One of it is understanding sexually transmitted infections. But in Nigeria, you hear of toilet disease. Let's look at what it means. Understanding sexually transmitted infections. We know the sexually transmitted infections like gonorrhea, chlamydia, hepatitis B virus, genital herpes, HIV, AIDS, and the HPV, human papilloma virus, responsible for causing cancer. Public lice and syphilis is also included. Then you have the trichomoniasis. Sometimes also your scabies is classified as a sexually transmitted infection. So, what are STDs? They are simply called sexually transmitted diseases or sexually transmitted infections. That means they are most often spread by sexual intercourse. They could be spread by other mechanisms, but the fact that they are termed sexually transmitted diseases tells us that most of the time they are sexually transmitted infections. Now, untreated sexually transmitted diseases can cause PID, what we call pelvic inflammatory disease. It's a serious condition in women. 1 in 8 women with a history of PID experience difficulties getting pregnant, and you can prevent PID if you know how to protect yourself. So, what is PID? Pelvic inflammatory disease is an infection of a woman's reproductive organs. It's a complication often caused by some STDs like chlamydia and gonorrhea. Other infections that are not sexually transmitted can also produce PID, but the most common symptom of PID is the lower abdominal pain in women and then the vaginal discharge. You can see this woman groaning in pain. Before we talk about the sexually transmitted infections and their prevention, I want to look at how do I get PID? How is it transmitted? You are most likely to get PID if you have an STD and don't get treated, or when you have more than one sex partner. So, if you had PID before, or you are sexually active, or you are douching, if you have inserted a intrauterine birth device for birth control. However, the small increased risk is mostly limited to the first 3 weeks after the IUD is placed by the doctor. But you can reduce your risk of getting a PID, and the only way to avoid STD is not to have vaginal, anal, or oral sex. I'll talk about that later. If you are sexually active, you can do the following things to lower your chances of getting PID. Reduce the amount of relationship you have. Being in a long-term, mutually monogamous relationship with a partner who has been tested and has negative STD test result. Sometimes you need to use that condom the right way every time you have sex, but we'll talk about that later. How do I have PID, or how do I know I have a PID? The diagnosis is usually based on a combination of your history physical examination, and your test result. You may not realize you have PID because your symptoms may be mild or you may not experience any symptoms. However, if you do not have symptoms, you may notice pain in your lower abdomen, you may have a fever, an unusual discharge with a bad odor from your vagina, pain and or bleeding when you have sex, burning sensation when you urinate, or bleeding between periods. I want to talk about this contraceptive use in prevention of unwanted pregnancies because many young ladies want a way out. They insist on sex, condom is failing them, so they are thinking of what next to do. You see, this woman is thinking of postinol use, but I must call your attention. The indication for postinol use is for morning after pill is used only as an emergency contraceptive. It is used to prevent pregnancies when taken within 72 hours, 3 days of unprotected intercourse. It's not used as a regular long-term method of contraception. Unfortunately, young or married people who want to use this as their means of contraceptive will get themselves entangled in challenges that they may not get out. It is designed for emergency usage, like in case of somebody that is raped. It's not for routine contraceptive use. So, if you need something that you want to use for prevention of pregnancy, postinor is definitely out of the question. It's out of the question. We'll talk about that when we discuss the prevention of sexually transmitted diseases. But look at it, postinor is an emergency contraceptive pill and it effectively renders the cervical mucus thicker to make it impenetrable to sperm. It has side effects like tubal pregnancies. So if you are young, you don't have a child and you are using postinor, at the end, you end up with a tubal pregnancy, you lose the baby. It causes unusual bleedings in young people and weight gain. So you can't be planning to be using it as your mode of contraception. The side effects, read them up. There are many, and you can't just use it except in conditions that you did not envisage, like rape. So let's go back to the topic of discourse, which is toilet disease. It presents with varied symptoms. Varied symptoms. The commonest symptom is vaginal discharge. I have seen women with vaginal discharge, they say they have toilet disease. I've seen women with boils or genital sores, genital rashes, and all sorts of things. They call it toilet disease. I've also seen a guy who had some irritations around the genital. He also said he has toilet disease. Whatever the experience around that, they prefer to attribute it to the toilet instead of sex. And that is perpetuation of ignorance. I call it a perpetuation of wickedness. Because if you don't know the cause of a thing, you can't prevent it, you can't treat it. And if you attribute it to the wrong cause, you cannot manage it. So you see a lot of women that think this toilet disease in the campuses on hostels. You see them buying personal pool, avoiding the public toilet, yet they continue to discharge. So it tells us that that's not the cause of the infection. Yes, someone can pick up an infection in the toilet. Yes, it is possible in women because the anus is very close to the vagina and the urethra orifices. So if a dirty girl who does not know how to clean herself properly can infect herself with fecal matter from the anus, gets into the vagina or the urethra tract, get an infection. Yes, that could is possible. Is a toilet disease, toilet transmitted disease, if you may permit me to use that word. But then it's not common. How can you just deliberately or unconsciously infect yourself? Are you a dirty girl? It is not a common cause of infection in women. What I know that is giving most of our young people continuous discharges is sex, because even at that, they don't want to abstain and they can't say, and they insist on sex and they insist on use of condom, and they keep discharging. But after this discourse, you might give it a second thought. Give it a second thought. Give it a second thought so you don't develop a PID. You don't lose your reproductive organs. Give it a second thought. So I want to look at the prevention of sexually transmitted infection if you now agree with me that it's a sexually transmitted infection. But if you don't agree, you can go back to your toilet disease. But for me, it's an STI and it can be prevented. And the prevention is simple ABC. I have so simplified it so you don't forget. I have so simplified it so you can teach my children, our younger girls, the truth. Stop perpetuating evil, telling people that it is toilet disease. No, talk to them about sexually transmitted infection. Teach them this simple ABC. Very simple for you to cram, very simple for you to grab, very simple for you to implement. The A stands for abstinence, where abstinence if you are not married. B stands for be faithful to your partner if you are married. And C stands for use condom when applicable. Fortunately, if you ask any young girl what is the prevention of sexually transmitted infection, they will tell you condom, which is just an adjunct here. We are bringing it in because we insist we won't have said and we can't be faithful to our partner. So that is why we bring it. Ordinarily, I will leave it out. If condom was solving all our problems, we will not preach abstinence. But today, we have no way to go but to hold on to abstinence because women are still having a lot of infections. And I will tell you how that happens. The condom that we use is a male condom. It's commonly used male condom. I've not really seen people use the female condom. I want to assume that the female condom is worse than the male. And the females can easily be infected even when the condom is being used because of the closeness of the anus. If the penis that is covered with the condom enters the anus and comes out, it will contaminate the vagina. That is how a man using condom easily infects the woman without knowing. So we still preach abstinence and be faithful to your partner if married. And don't tell me that I have only one boyfriend. You are not faithful to God. And the reason why you are keeping only one boyfriend is the reason why you will keep two, three, or four because you cannot say no. You are still so much unfaithful. But learn to be faithful. If you are married, be unfaithful to God and abstain from sex before you're married. If you are married, be faithful to your partner and reduce the risk of catching a sexually transmitted infection. We'll talk about the side effect of condom use. You can Google it up. They are all there. But if you also pick a piece of condom and read through the manual, you see that it does not guarantee you total freedom from infection. But unfortunately, I've seen a lot of ladies who are confidently using condom and presume they will not have a sexually transmitted infection, and they don't want to agree until I've explained to them you can use infection and be infected. You can use the condom and be infected. So the reasons are very obvious. The number two and most important side effect is the loss of willpower. If you keep on using condom, it means that you don't have a power over your will. So you have lost your power to say no. So on a bad day, you are ready for sex and there's no condom, you can't hold it, you must have sex. That is how the condom has failed so many people. It is failing people, you depend on it and you keep getting infections, you still are still getting pregnant. It will fail because it cannot save us. That is the reason we still preach abstinence. Still on condom use, the latex greatly reduces uh, sexual stimulation and does not eliminate the risk of catching or spreading STDs. Yes, we have said that. And if you and your partner want to use the condom, use the polyurethra and allergic condoms. It's the most reliable way to avoid infection. It's not to have anal, vaginal, or oral sex. Then, before we draw the curtains on the prevention of sexually transmitted infections, it's important to mention that two very important sexually transmitted infections can be prevented by vaccination, which is the human papilloma virus, which is the virus that is responsible for causing cervical cancer in women, and the hepatitis B is also sexually transmitted. It can be prevented with vaccination. So get vaccinated. Get vaccinated. Did you hear me? What did I say? Go get your cervical cancer vaccination and get yourself vaccinated for hepatitis B so you will stay alive and healthy. On a last note, I must say that everyone is on a spiritual journey with the Lord. So, how can we help you move yours forward? You can join us at Palace of Priest Assembly, opposite Bobo Petrol Station along Abu Eku Expressway, Abraka. And that is my phone number. You can call or you can write to pastorwisdom2000@gmail.com. I remain the purpose dot. Thank you.